Hello everyone, welcome to another episode of Learning on Smart Nursing. My name is Nurse Evie, and in this video we want to look at arterial blood gases, basic interpretation of arterial blood gases. Okay, by the end of this video we want to be able to help you understand what arterial blood gases are, know the basic interpretation of arterial blood gases, know the component and then their normal values. Okay, and at the end of the day you should be able to interpret and tell whether or not the patient has a metabolic or a respiratory problem. Okay, so basically arterial blood gases, or what we call ABGs, the test that we do that gives us an idea of a patient's respiratory or metabolic system. And then it also gives us values of the carbon dioxide, values of the bicarb, values of oxygen, okay, partial pressure of oxygen, saturation of oxygen, and a whole lot. In fact, the ABG result can give you electrolyte that even guides you to be able to calculate the anion gap of a patient. Okay, then it will tell you what exactly is going on. As the name depicts, it is taken from the arteries and not the veins. Okay, so the procedure of collecting samples for an arterial blood gas is a whole procedure on its own, and it's only done by trained accredited people, because going into the artery needs a lot of skills. Highly skilled professionals are the only ones who go into the arteries. Okay, so let's look at the arterial blood gases. Now usually an ABG result looks something like this. Okay, but for the sake of this video we're going to concentrate on the pH, we're going to concentrate on the carbon dioxide, and then the bicarb. Okay, so the normal values of the bicarb, carbon dioxide, and pH is what you can see over there. So these are the normal values, and these are usually the reference points, okay, in identifying what is going on. Now, like I said, there are so many values on the ABG, but we're going to concentrate on these three for the purpose of today's video. Okay, so when you want to read an ABG, there are 5 main steps that you need to follow. Trust me, when you take these steps one after the other, you will not miss any acid base imbalance. Okay, so 5 main steps that you need to follow, and always have the acronym ROME in mind. Respiratory opposite, metabolic equal. Okay, respiratory opposite, metabolic equal. Always keep this acronym in mind and follow these 5 steps that I'm about to teach you right now. So the first step is to look at your pH. The first step when you take an ABG is to look at your pH, because at the end of the day the pH is what is determining the whole thing. Is it an acid problem or is it a basic problem? Alkalosis or acidosis, the pH will tell you. So look at your pH. Is it lower than the the normal value, or is it higher than the normal value, or is in the middle, where it is? First of all, look at your pH. Okay, then the second thing that you need to do is you look at your carbon dioxide, your respiratory component, comparing it to the normal value. Okay, what is it? Is it also normal, lower than the normal, or higher than the normal? Look at your respiratory component. Then your third thing is to look at your bicarb component. What is your bicarb telling you? Is it also normal? Is it less than normal? Or is higher than normal? Okay, fourth thing will be to determine whether it is compensated or not. Okay, and if it's compensated, is it partial, is it full, it's compensated at all? That is the fourth thing. And then the fifth thing is to look at your oxygen saturation. Okay, so when you take an ABG, have your ROM in mind, respiratory opposite, metabolic equal. Then go and look at your pH, number 1. Number 2, look at your carbon dioxide. Number 3, look at your bicarb. Number 4, maybe you want to see if it's compensated. Okay, then number 5, you look at your oxygen saturation. Okay, so these are the main steps that guides you to be able to interpret the basic ABG. Okay, now let's take a few examples and see how this plays out. Always bear in mind your ROME, or room. respiratory opposite, metabolic equal. So our pH here is up. Our pH is up, and a pH that is up is alkalosis. Okay, this is an alkalosis. Okay, now let's go back and look at what the others you say. Our pH is up and it's alkalosis. Our carbon dioxide is 28. It's down. And if carbon dioxide is down, it's also what we call alkalosis. Okay. We said that anytime you see carbon dioxide, think of acid. So if it is down, then it means that it's alkalosis. Can you see something here? pH is going up, carbon dioxide is coming down. We've already satisfied our opposite direction. Okay, so if it's a respiratory problem, we will see that it will be opposite. The respiratory or carbon dioxide value will be opposite the pH, and this is what is happening here. But well, let's look at what's going to happen down here. So BiCAP is 24, normal. So this is normal, and then putting this and this together, we have what we call respiratory alkalosis. Okay, respiratory alkalosis. That is for the first one. Okay, so pH of 7.28 is low, right? And then look at carbon dioxide, 85, which is high. So our carbon dioxide is high, right? And anytime carbon dioxide is high, where you see carbon dioxide, think acidosis. Then our BiCAP is 24, which is normal. So what do we have here? Respiratory acidosis. Okay, let's take another example. A pH is low, 7.2. Carbon dioxide is 32, which is normal. BiCAP is 15 and is low. What are we seeing here? Metabolic equal. Metabolic equal. pH is low, BiCAP is low. Okay, so this is what metabolic acidosis. Okay. The final one, pH of 7.50 is high. Carbon dioxide is normal. Okay, BiCAP is high. Okay, and so this together will give you what? Metabolic alkalosis. So always pay attention to the respiratory opposite, metabolic equal, and you go through your 5 steps. Brings us to the end of this video. My name is Miss Evie once again, and then I hope that we've been able to help you understand and interpret ABGs, basically. And then watch out for the video when we take you through compensation, okay, because it gets a bit tricky. So we take you to compensations, and then you understand what is partial, what is full compensation, what is uncompensated. By now you should be able to tell what an uncompensated problem is. Thank you so much for watching, and we'll see you in another video.